Hi everyone, welcome to our channel. If you're new here, my name's Kate. I'm a certified athletic therapist and certified prenatal and postpartum strength coach here at the Pain and Performance Clinic in Dublin. In today's video, we're going over the core pelvic floor connection breath. So this is a form of deep breathing or diaphragmatic breathing. It is a technique or a skill that can be tricky to learn, so consistency is important. So daily practice for a few minutes every day can help to build this skill. This is very important for individuals who are postpartum, so women who have just recently given birth, also for individuals experiencing low back pain or groin pain. Typically with groin pain and low back pain, individuals tend to be quite tense and tight in their core area. Women who are postpartum, during pregnancy, the muscles of the pelvic floor can weaken from the amount of pressure being placed on them and from childbirth. So focusing on the deep breathing that involves the pelvic floor can help to re-strengthen them. Now, a lot of individuals who are in pain or who are postpartum, with every breath, their chest expands, but this area here tenses and tightens. What we're trying to do here is a little bit different. So with every breath, we're trying to expand the trunk area, both forward, to the sides, and behind. So we're trying to inflate all of this area with air. The way your body works is, so with your rib cage, you have your lungs within the rib cage. Underneath the ribs, you have a big muscle here called your diaphragm muscle. Your organs would be in this area, and then where your pelvis is, you have some muscles within the pelvis. So with every breath, what happens is we want this muscle here to expand or lengthen. So when you're breathing, so you breathe in through your nose, trying to fill that area here with air. And when you're able to do that, what happens is that diaphragm muscle lengthens. Air gets pushed down, and while you're doing that, we're trying to let the pelvic floor relax. On the breath out, then we do the opposite. So when you're breathing out, this muscle, your diaphragm muscle, contracts to help get the air out of your lungs. And when that happens, we want the pelvic floor muscles to lift or contract. Being able to sense your pelvic floor can be quite difficult. So one analogy that's helpful for some people is to imagine you're going to the toilet, but during the mid-flow, you're trying to stop that flow. Then the opposite to relax the muscles would be, if you're able to go to the toilet, you contract, you stop that flow halfway through. Then when you let that flow continue, those pelvic floor muscles are relaxing again. Another analogy would be the balloon breathing. And so with every breath in through your nose, you're trying to imagine you're inflating a balloon around that midsection. So that balloon is inflating in all directions. When you're breathing out, then that balloon is shrinking as the air leaves the balloon. When we're breathing, we want to be slowing it right down. So on the breath in, you're breathing in through your nose for 3 seconds. Breathe out all of the air. So very slow exhale, getting all of that air out of your lungs. After you've done that, then you're pausing for a brief second, and then you breathe back in for 3 seconds. So it's a very slow, controlled breathing technique, focusing on expanding this area, letting the pelvic floor relax, and slowing it right down. So now we'll go through some drills or exercises that you can do to incorporate this breath. Very important in order to nail this technique so that it translates to other activities in your day-to-day. So if you're a mother, being able to bend down and pick up your child, breathing with the connection breath can be very helpful so that everything is nice and stable and strong and you're not sore. And then also this ties into other exercises in the gym. So if you're able to control and use this deep connection breath, it can make all your bigger lifts much more efficient, and that way you're not using too much tension or too little tension during your gym exercises. Okay, so in this next part of the video, then we're going to go through a few exercises or drills that you can do to practice that connection breath. So level 1 is just laying on your back. So you can do this on your bed or on the floor at home, and we're going to focus on getting that deep connection breath. Lay on your back, have your knees bent and your feet flat. And then when you're doing this, so remember, with every breath in, we're trying to expand this area. So you're inflating your trunk all around, your back is pushing into the floor, the sides are expanding, and your belly is rising with every breath. While we're doing that, we're trying to let the pelvic floor relax. So you take a big breath in through your nose for 3 seconds. Breathe out nice and slow. Breathing out all of that air. So when we're breathing in, try and imagine you're trying to let that pelvic floor relax. So whether you're using the balloon analogy or going to the toilet and letting those muscles relax and continue that flow, either way works, but have your hands on your stomach here, breathe in for 3 seconds, inflating all around. And then breathe out nice and slow, letting all of that air leave your lungs. Your stomach should be nice and flat when you've exhaled all that air. Once when you feel you have practiced that and you have that ability to expand all around, you're feeling your pelvic floor contract as you breathe out and relax as you inhale, then you can go into level 2. So level 2 would be now we're trying to add in a bit of movement. So we're still in this position, but now what we're going to do is lift the hips up and go into a glute bridge. So you're gonna breathe in here first, fill in that air, imagine you're inflating your lower trunk area. And then on the exhale, you're gonna push through your heels and breathe out. You should feel these muscles do a little bit of work. Relax back down, breathe in for 3 seconds again, filling your trunk with air. And then breathe out as you press through the heels, and your stomach should feel flat at the top. So practice this, do about 10 to 15 reps. And when you feel like you've paired those two movements together, then you can go into level 3. So this is where we add in some core work. So now you're going to inflate this area again with air, just like we have been doing with that core pelvic floor connection breath. But now we're going to breathe out all that air and involve the core muscles. So for this one, have your hands at your side, take a big breath into your belly for 3 seconds. And then you're going to breathe out. Lift your shoulders off the floor, feel your stomach flatten, and feel those muscles here in your trunk really work hard. Control the way back down, just fully relax, take another big breath in, and then breathe out, and lift up. For some women who are postpartum, you might find that you have some coning here, which is where the ab muscles dome or kind of bubble upwards. If that's happening, really focus on breathing out all of your air before you're lifting up. If you're still struggling with the coning, then that is a little bit too challenging for you at this moment. Just focus on that breathing in this position and focus on the bridge. The core one here is a little bit more challenging, and we don't want that coning to appear. So again, for the core one, big breath in here, breathe in for 3 seconds, breathe out all your air, get those muscles working, pause for a second, and control the way down. So make sure that pelvic floor is relaxed with your breath in and everything is kind of contracting as you're coming up. Those exercises there are 3 little things that you can do at home. You can do these in the gym as part of your warm-up, your cool down, or as your rest break, but try practicing these on a daily basis. Build the skill, and that way all of these muscles will relax, but then also your pelvic floor will strengthen. We hope that video was very helpful and that you've learned now how to do the core pelvic floor connection breath. Don't forget to hit that subscribe button, hit the notification bell so that you never miss a new video. And if you have any questions, just leave them in the comments below.